Hello everyone. We are discussing this X-ray series under the heading Reflection. How the anatomical landmarks reflects on the chest we are discussing. This is Professor Dr. Prashant Busari welcomes you on this emerging MEDTALK. So discussion is on pathological or the abnormal conditions of the chest X-ray. So we already know the various normal X-rays. How it represent here is the we can see the this midline translucent trachea. Then this is right lung. Here is the left lung. Here is the cardiac shadow. These are the clavicles bones. These are the scapulae. Then we can see the right dome of diaphragm, left hemidiaphragm, then the right cardiac border, left cardiac border, and these are the bronchiovascular normal markings and having radiologically lung having 3 zones. So if some lucencies and opacities having its different patterns, so we'll discuss how it appears on the abnormal chest X-ray. So here we can see the opacity on this first, second, and also we can have on the fourth part, and the some lucency without the bronchiovascular markings. So which condition we call? So these we will see. So abnormal these conditions. So very common is the pleural effusion, where this fluid it accumulates within the pleural cavity, and in this we can see there is a obscure or the left costophrenic angle is not seen clearly, obscure in condition of the pleural effusion with the homogeneous, now we can say the radiopacity, and also there is a little shift of this trachea or the mediastinum towards the opposite side. Then pulmonary consolidation, where it is due to infection, then we call it as this pneumonia, and we can see here this radio opacity in the right middle lung zones, and these if they particularly the alveoli they are replaced by the fluid or these infective foci, and the pneumonia may be lobar or the interstitial or the bronchopneumonia and having various patterns. So here is pulmonary tuberculosis, in particular 60s to 70s in the India, very common and in the right upper lung zone, but when it the spread is hematogenous, then the condition is called as miliary tuberculosis, where the appearance is diffuse nodular appearance. Then pneumothorax, we know the lucency in the lung particularly having the bronchomuscular markings, but when there is a clear-cut translucency without the bronchiovascular markings, and it is after the trauma or the road traffic accident where the air trap in the pleural cavity, then the condition is called as pneumothorax. Then we know the cardiothoracic ratio is 50 to 55%, and if it is more than, the condition is called as cardiomegaly. Then aortic aneurysm, particularly the dilation of the aortic knob at the level or aortic knuckle, and there is what we can say enlargement of the aortic knob and displacement of the trachea towards the affected side, also opposite side, the condition is called as aortic aneurysm. Then the emphysema, particularly in old age, where the bilateral we can say the hyperlucent lungs, and the domes also they are looking like flattened, they are not dome shaped, and also ribs they should be oblique, but here looking we can say horizontal, and there is a narrow mediastinum in this condition of emphysema. Then collapsed lung, where there is volume loss, very important, with volume loss here in the right lung with the we can say pulling of that trachea or the mediastinum towards the affected side. This is a very peculiarity of the collapsed lung. And where is the loss of cortical continuity, there is a reef fracture here, and also there is a clavicular fracture in these conditions. Then we know 12 ribs arises from the thoracic vertebra. If extra rib arises from the 7th cervical vertebra, the condition is called as cervical rib, where the very small extra rib arises from the 7th cervical vertebra. Then the bronchogenic carcinoma or the lung mass, where we can say particular old age, smoking history, and we can say there is abnormal ill-defined opacities involving some part, or it may involve most of the lung parenchyma, that may be the condition due to metastasis. So here we can say the lung mass and not responding to the treatment. So there is a dextrocardia, where we know normally the heart major portion is placed on the left side. If it is placed on the right side, the condition is called as dextrocardia. Here we can see particularly, and it may be the part of situs inversus, and it may be involved in the syndrome called as Cardagna syndrome, where there is a dextrocardia, then there is a stereocilia, infertility, there is infections, and the condition is the Cardagna syndrome. So this is what the different, what we can say, the abnormal or the pathological conditions of the this chest X-ray. So if you like, if any queries, if any problems, suggestions, please add in the comment box, and we have different X-rays series on this of body on this under the series reflection. So having various videos, so please subscribe for the further videos. So this is all about what we can say for the today's discussion, that is abnormal chest X-ray. Thank you.